This is the remote learning lecture for kinesiology. Particularly, we'll be looking at the cervical spine, thoracic spine, and lumbar spine musculature and ranges of motion. The first aspect of range of motion is to be looking at the total degrees of normal ranges of motion, especially when we're looking at flexion, extension, lateral rotation, lateral flexion, or any type of rotation. The first one we'll be looking at is flexion. So when we're talking about flexion, the head usually has about 10 degrees of capital flexion, and then including the cervical spine, we come up with a total of 45 degrees. So from C1 all the way down to C7, so this range, we tend to say that an individual can put their chin to their chest, and this usually correlates with the ability to flex the neck at 45 degrees. To go into extension, the opposite direction, we should also be able to extend, which means moving the skull into the posterior direction. And with this extension, we should also be able to achieve roughly 45 degrees. Lateral flexion, when we're looking at lateral flexion, we're usually looking at somewhere around a 45 degree. And when we're looking at 45 degrees of lateral flexion, we should be able to notice that the head doesn't rotate, the eyes stay centered, and that the eyes and the chin move as one unit into the 45 degrees of lateral flexion. And finally, with rotation, usually bringing the chin over the top of the position of the clavicle. So usually if you can rotate the chin to the middle of the clavicle, we would say that you have the ability to rotate approximately 60 degrees of cervical rotation. When we're looking at the lumbar spine, we flex approximately 80 degrees, and there's a couple of different ways of doing that. We could have a tape measure from C1 to C7. We could take that measurement. We could have you touch your toes or drop down into a forward fold position, remeasure from C1 to C7, and we should see that the spine has actually elongated. So for instance, my standing spinal S1 to C7 is about 16 inches. When I go into flexion, when we do the remeasurement, I usually come up about 21 inches. So we have the ability for that vertebral column, like a set of building blocks, to move in an anterior position, which gains length through the entire spine. So that's one way of measuring approximately 80 degrees of flexion. We could also measure this other degrees of motion of extension. This one is probably the least effective way of measuring the extension of the lower lumbar because the pelvis is not situated in a stabilized base. So we prefer to measure somewhere with the pelvis being stabilized. In this case, we have the pelvis underneath the anterior superior iliac spine of the pelvis. And then the individual will be able to raise at a minimum or extend the spine from L5 to approximately 20 degrees. When we're looking at spinal rotation, the first one that we're going to be talking about is going to be the lateral lumbar flexion. So standing without the bending of the knees, so we should be able to maintain extension through the knees. You should be able to laterally flex the spine at 35 degrees in each direction. Rotation, we usually prefer to measure rotation in a seated position. And in the seated position, we should be able to rotate the lower back or the lumbar and the thoracic spine within a 45-degree angle. And while we're doing this, we're looking for any compensations, meaning changes in the position of the spine. So we're trying to make sure that each one of these movements is being measured with a limited amount of altered motor control or compensation during the movement. So the three main muscles that we tend to look at when we're dealing with movement of the head are the ones that are connecting to the base of the occipital or the skull, and also the ones that are connecting into the cervical spine. So we'll begin our discussion talking about the splenius capitis, which you can see here, the sternocleidomastoid, which comes into the anterior compartment, and then the smaller splenius cervicus. So the sternocleidomastoid, its origin is actually on the clavicle and the manubrium. So again, remembering that when we're looking at the origin, this would be relatively the fixed site. So we have one origin of the manubrium of the sternum, and the other origin will be situated on the medial side of the clavicle. The insertion point for the sternocleidomastoid is going to be the mastoid process, located right behind the meatus of the ear. Now, with its job, when the sternocleidomastoid, when both sides are contracting equally, its main job is for extension of the head, particularly where we see the head tilting onto C1. It also, universally, when we contract both of them, it contributes to flexion of the neck. If we are only to contract the right side of the sternocleidomastoid, this muscle, the right side, will contract and make rotations to the left and left lateral rotation, or in left flexion to the right. If we're looking at the left side, it does two jobs. So the left sternocleidomastoid, it would first allow you to rotate the head to the right, and the left side will do lateral flexion to the left. So we can see with rotation exercises or movements, the right side and the left side are going to move the opposite direction. So the splenius muscles include the cervicus and capitis, and the biggest difference is going to be the capitis is going to insert into the mastoid process, and the cervicus is going to insert into the transverse processes of the first three cervical vertebrae. Together, both of these muscles are going to extend the head and neck. And when we see this extension, this muscle is primarily under strain due to the forward head position that we tend to be in. So the first one is going to be the splenius cervicus. We can see here that the origin is going to be along the spinous processes of the third through the sixth thoracic vertebrae, and it's going to insert on the transverse processes of C1 through C3. Where we see the difference is going to be first in the origin of the splenius capitis. It's a fairly lengthy, it's the spinous process of C7 and then T1 through T4 thoracic vertebrae. And then we're going to see it inserting up here in this region, and this is going to be the mastoid process and the occipital bone of the skull. The right side, if we were looking at their functions, the right side is going to rotate and laterally flex to the right, and then the left side would rotate and laterally flex to that same side to the left. The muscles of the vertebral column, these are going to be the most deep muscles of the spinal column. We call these the interspinale intertransverse group. They're going to laterally flex and extend the spine. Very important note is the interspinales do not rotate the vertebrae. So they're going to do very fine motor movements, and the first one is going to be these interspinales. They connect from one spinous process of one vertebrae to the other spinous process of the adjacent vertebrae, and their main job is for extensors. When we look at the intertransverse intertransversari muscles. Their job is to connect the transverse processes, and their job is to flex the column laterally. So this one right here, the intransversaries, they're going to be primarily function with laterally flexing the spine. So some of the key muscles involved in the lower back, and probably the one that gets compensated the most, is going to be the quadratus lumborum. And primarily the reason why we see a compensation is because of the origin of the quadratus lumborum. Since it's on the, the inner upper lip of the iliac crest, the origin is usually supposed to be fixed, but we know that the pelvis can do a tilting, a lateral tilting motion, an anterior and a posterior tilting motion, and which causes a lot of tension in the quadratus lumborum. Its main job is to stabilize the pelvis and the lumbar spine, but if we have a moving origin, this muscle tends to develop a lot of excessive tension. So its main job is to produce an anterior pelvic rotation. So allowing for an anterior pelvic rotation would be tilting the spine and increasing that posterior concavity in the lower back or the lumbar region. Its insertion is going to be on the 12th rib and the transverse processes of the L1 through L4. So we can see here how it's attached to the 12th rib, and then we see the insertion in L1 through L4. Its primary job is for extension of the spine, anterior pelvic rotation, but it can actually do lateral flexion, and it can also do lateral pelvic rotation on the opposite side. So with the erector spinae muscles, we'll go through each one of these. The first one is going to be the iliocostalis group. And I always like to start these discussions with where it terminates. So we see the iliocostalis muscles terminating on the portion of the cervicus muscle, but it's going to catch the thoracicus, and it's also going to be connected into the lumbar. We can notice that this is going to be running on the most lateral surface of the ribs and eventually into the transverse processes of the cervical spine. The second one, the longissimus group, starting at the top, is going to terminate at the splenius capitis muscle. It's also going to be drawing in to the splenius cervicus, and we see the termination point of the longissimus at the thoracicus region. And finally, the last one we have is the spinalis group. And with the spinalis group, this is going to be the most medial group. And with the most medial group, we're going to be looking at where it begins. And it begins at the cervicus. It is then, with the spinalis group, it begins at the capitis here. It adds the cervicus, and then again it's going to terminate. The spinalis group is going to terminate at the thoracicus. So the only one that goes from the cervical spine to the lower lumbar is going to be the first one, which is the iliocostalis. So when we're looking at the posterior muscles of the thorax, we'll bring into play some of the key muscles that we utilize for expanding the breathing during exercise. The primary one that we should be utilizing is going to be the diaphragm, which lies underneath the ribs here. And the diaphragm is what is going to produce the vertical nature of breathing. But the diaphragm is most important, or the strongest skeletal muscle is associated to breathing. To make anterior change of the chest wall during breathing, we primarily see this with the scalenes. They elevate the first two ribs. We use this a lot with hyperventilation or any type of breathing during exercise. And then the external intercostalis muscles that are located here between the ribs, these are going to help make lateral changes to the lungs during hyperventilation or breathing. The only one that we see that's utilized for forced expiration is going to be the internal intercostals. Also for forced expiration, we tend to use our abdominal muscles to push against the diaphragm, also for forced expiration. So with the abdominal muscles, their main job is going to be for producing lumbar flexion. So when we bring our hands down to our toes, the origin of the rectus abdominis is going to start at the crest of the pubis, and it's going to insert at this region here, which is the cartilage of the 5th, 6th, and 7th rib and portions of the xiphoid process. As mentioned earlier, its main job is to lumbar flex the spine. It also contributes to a posterior pelvic tilt, which flattens the lower back. The right side has a weak lateral flexion to the right, and the left side would have a weak lateral flexion to the left. The external obliques, these are very important when we're looking at the origins, which is fairly large. So any type of rotational motion, we see the lower 8th ribs kind of closer to the serratus anterior muscle, and then it inserts on the upper half of the ilium and also deeper into the inguinal ligament. So when we're looking at the external obliques, its main job is to lumbar flex, so both lumbar flexing to the left and to the right. Its other job is to posterior tilt, which means bringing the pubis underneath, creating more of a flat back look. And then when we're looking at rotation, if we are going to do a right hand sit up, what we see is that during going to a right in a sit up, we would be using the left side, and if we were going to the left in a rotational sit up, we would use the right side. So if I was going to go up into a right rotational sit up, as stated here, rotation to the right occurs. So if I was going to a right side sit up, I would be using my left external oblique. If I was going to go towards the left side, I would be using my right external oblique. And it's going to be opposite when we look at the internal oblique. So when I'm doing a left-sided sit-up, I'm going to be, if I'm rotating to the right, I'll be utilizing that same side. So in a right-handed sit-up, I would use a right internal oblique and a left external oblique. If I was going to use a left rotational sit-up, I would use my left internal oblique and I would use my right external oblique. This contra movement of internal and external oblique muscles helps stabilize the spine. So again, when we look at the internal oblique, it's more in the anterior compartment, but we see the upper half of the inguinal ligament and the anterior crest of the ilium, and the insertion is going to come at ribs 8 through 10. The transverse abdominis, since it's located in the front, this is also used for, in the anterior compartment, forced expiration. And we see it originating first in, down here, the inguinal ligament again and the rim of the iliac crest. And we see the insertion at the insertion is going to be at the crest of the pubis and the iliopectineal line which is further down. Basically, this whole region. So we see the origin here, and then the insertion would be out here. With this setup, the transverse abdominis also, if it's engaged, helps support the lower back. It produces a posterior tilt, which means that we're bringing the pubis to the anterior compartment. So this can be utilized to help stabilize the lower back. So with this chart, this is the beginning of the introduction of where each one of these muscles are going to be innervated at. And to make it the easiest, we'll be talking specifically about where the spinal root, where it comes from. So the splenius capitis is going to come from the spinal root of C4 to C8, and if we follow the posterior lateral branches, it will innervate into the splenius capitis and cervicus. The big one is going to be the erector spinae. So because we're pulling in the splenius capitis and cervicus, and on some of them all the way down into the lumborum, we're effectively going to be using the spinal nerves of C1 all the way down through C5. And these are considered posterior branches or segmental branches of C1 through L5. The rectus abdominis is going to take in from T7, so this region T7 all the way down through T12. It's usually stimulated by the intercostals, which are located between the T7 and T11. And then the next one is going to be the external oblique. So just moving slightly down, we're only going to be incorporating T8 through L1. And as you can see here, we're bringing in the inguinal ligament, the iliohypogastric ligament, or nerve, and the intercostal nerve. So these three are going to be contributing to the external oblique. But again, it's bringing in the spinal root from T8 all the way down to L1. And then finally with the internal oblique, when we're looking at the internal oblique, we see that it's going to also, very similar, going to bring in from spinal nerve root T8 to L1. It's going to be contributed from the ilioinguinal ligament, or ilioinguinal nerve, the iliohypogastric nerve, portions of the subcostal nerve, and on top of it, the intercostal nerve. So this is just going to be the nerve that is going to stimulate the internal oblique. And finally, the last one, the quadratus lumborum. It's going to take in from T12, so basically from the area of T12 all the way down to L4, which is all of the branches, the posterior branches of T12 to L4. And this is going to contribute to the quadratus lumborum. So the most important aspect is understanding that the erector spinae muscle is going to cover the entire spinal nerve root from C1 to L5.